I want to talk about MPOX. I'm going to guess that your first thought right now might be, why? Isn't that virus done and gone? Well, it's not. 2 years after the U.S. declared the MPOX outbreak over, a new crop of cases is now showing up in California, and the latest strain is considered more dangerous and more infectious. All of those cases diagnosed in the U.S. led to hospitalization. Further sounding the alarm, the World Health Organization said earlier this month that the clade 1b strain of the virus has been found across more than 40 countries. The threat of MPOX isn't lost on Partha, Associate Project Scientist in the Department of Medicine at UC San Diego School of Medicine, and Mete Aslan, doctoral student at Boston University. They were part of a team that developed an optical biosensor that can quickly detect the virus on the spot, and it's so compact that it can be taken to even the most remote locations. If you're still not interested in MPOX, let me tell you that this sensor can be calibrated to detect other viruses too, and I know none of us want to live in another pandemic. Up next, hear Ray and Aslan talk about the potential for this biosensor and the hurdles they're still facing.
Today's episode is brought to you by Hamamatsu Corporation, a leading manufacturer of devices for the generation and measurement of infrared, visible, UV light, and X-rays. Hamamatsu is dedicated to the advancement of photonics through extensive research and offers specialized systems for select applications. Visit hamamatsu.com to learn more. Today's episode is also brought to you by American Elements, the world's leading manufacturer of engineered and advanced materials, with a catalog of over 35,000 products available in both industrial bulk and laboratory quantities. To learn more, visit AmericanElements.com. American Elements, now invent.
From Photonics Media, this is All Things Photonics, a podcast where we explore industry-shaping advancements in lasers, optics, imaging, metrology, and sensing. Each episode, we'll speak with some of the brightest minds in industry and research about the trends shaping the landscape of photonics.
A very interesting read, and to see the ability to better track and diagnose MPOX. So going into this, the World Health Organization still tracking the spread, is still on high alert for the virus. So tell me how this discovery came to be to find this breakthrough in detecting and diagnosing MPOX.
Sure. Yeah, I can answer that. As I said, I am in the Department of Medicine. So we were looking for assay or a point of care technique that can detect monkeypox quite easily, because the assays that are available right now are based on PCR, which requires dedicated laboratory trained personnel to run those assays. And generally it takes a couple of days to weeks to get those results back. So we were looking for an assay that can give us an answer rapidly in a point of care setting. So that is when I got interested in the technique that Salim's lab has been working on. They have developed at Boston University. And their technique is based on a label-free technique, which means that they don't require any pre-processing steps before getting the assay results. Most of the assays that if you see, for example, the PCR, it requires isolation of nucleic acid, either RNA or DNA, or the assays, for example, the ELISA assay, which is a gold standard in terms of antigen-based assay, they require isolating the proteins. But the good thing about the technique that Salim's lab has developed is it doesn't require any pre-processing steps. So that was what actually initially made my interest in collaborating with them, because this assay can simply work by capturing a nanoparticle. So in our case, what we did is we had an antibody that was specific for one of the proteins that are on the surface of the monkeypox. So the assay simply works by mixing the antibody with the virus and then capturing this complex, the virus and the antibody complex, on a sensor chip. And it simply works by shining two different wavelengths of light. In our case, it was a red light and a blue light. It is as simple as that. And then because of the interferometric techniques that they have developed, it can detect those virus particles using a simple camera, and we can get the data in real time. So in our case, what we have shown that with the monkeypox samples that we use, and these were inactivated samples. These were heat inactivated samples. So we used them, and we could detect the virus within 2 minutes as compared to the control. Basically, what we can do is, using our technique, we can detect the virus right from collecting the samples to getting the results within 20 minutes, which is well within the framework of point of care technique. So that is the beauty of our technique. And this technique is also modular. So this means that it is not just restricted towards monkeypox detection. We can detect other viruses, other pathogens, using specific antibodies that can capture those viruses or other pathogens, even bacteria. So that is the beauty about this technique.
And to quantify that, we can understand why being faster can make sense. But what can this mean to cut out the wait time it used to be to diagnose, to have these accurate responses turn around, nearly immediately compared to what it was before?
Sure. So what we have learned from the past pandemic, which is in our recent memory about the COVID-19, is initially the kind of assays that were obtained through the clinical diagnostics were again based on PCR. So for fast-moving pathogens, which means fast-spreading pathogens, in the previous case it was COVID-19, and it might be also the case with monkeypox, because right now monkeypox is a big problem in Africa, but it is not going to be restricted within Africa. I mean, it is going to spread for sure, and we have seen some cases outside Africa right now, and the the strain that we are talking about is highly pathogenic, as compared to what we have seen in 2022. Monkeypox has two different strains. One is called clade 1 and clade 2. So the past one, which was around 2022, which was making big news all over the world because it was spreading like crazy, that is less pathogenic than what we are seeing right now in Africa, which is clade 1. So it is a big problem. It has spread all over the continent in Africa, and we're seeing cases in other countries too. So, I mean, we know, because in today's world, when traveling is so freely accessible, people are traveling all the time, it's going to spread. So, in this situation right now, if we don't have a technique or an assay that can detect the pathogen quickly, it is going to be very challenging to restrict it. And because of the scenario that we don't have proper medication against monkeypox, there's no FDA approved medication against monkeypox. Also, the vaccines that we are using, it is not specific for monkeypox. Actually, I mean, the vaccines that we are using, we're repurposing the vaccines which were made against smallpox. And having said that, I mean, the amount of vaccines that we have right now is also limited. It's not like it is unlimited. So in this kind of situation, it will be the best case scenario if we can detect the pathogen faster and then isolate the patients so that it doesn't spread. So in that case, in that scenario, our technology is going to be very beneficial in terms of identifying the patients quickly and quarantining them so that it doesn't spread.
Right. So naturally, we don't always have the cure or the vaccine for something, but if we can isolate the cases, remove the people from general populace, that's always going to be one of the quickest ways to limit the spread.
Yeah.
Gotcha. Well, let me ask, so, like you mentioned, Africa is really struggling with MPOX, and not every nation has the same means to set up a lab or to set up a testing facility. How easy is it to take this system into another nation, especially one that, doesn't have all these resources, and to set this up to start testing, to start diagnosing patients?
Sure. I mean, I can answer briefly, and then I will let Mete to answer. The box that we are using, it is kind of like a little bigger than a shoebox, so it is easily portable. And they have been taking this box to different continents. They have set up labs in Turkey, in UK, several labs in here around. So it can be taken on a plane, can be assembled very quickly. And as like we said, the assay itself is very easy. I mean, even like a person who is not trained, a novice person can simply take the samples, mix it with the antibody which we are going to supply as like a lyophilized powder form. Simply mix it, put it in the machine, and then voila, like you get the result. So in terms of using it or deploying it, I mean, it's pretty easy.
So right now, what we did is we developed a prototype for the detection system for monkeypox. But using our previous study developed in our lab before I joined the lab, so we can make the box more affordable for such countries. For instance, right now the box is using a pump. First of all, the prototype system, the optical system, can be fit into a box with size 20 centimeter by 50 centimeter. So you have a compact box. Right now, we introduce a sample, low volume sample of 100 microliters with a syringe pump, but that also can be easily replaced by a passive cartridge that works with a absorbent paper. So with that, everything will be disposable. The chips will be disposable. What remains is the box, and it has some processor inside of it. It can real time detect and count the infectious particles.
That's amazing. So, something that can be readily taken to the hot spots that are seeing the worst of this, and just something that can be kind of massively released. So then let me ask too, where do you gentlemen see this technology going? What is your hope for this now? Because this is not something that's a great invention to use down the road. This is something that could be immediately used. That could be, we could immediately see benefits in other nation if we can get out there. So what is your hope for this and battling future health crises and current health crises?
Sure. I mean, I can talk briefly about like the non-science part of it, which is the biggest hurdle right now, because the amount of grants that is available for monkeypox right now in this country, like we have been looking for grants and we have been like approaching a lot of people. Honestly, there's no grant for diagnostics right now, especially for monkeypox. That is unfortunate because honestly, I'll be like, mm, what I would say is like, the problem here is like, as long as it's not a problem of this country, like people don't invest. It is like unfortunate truth about it, and I'm being like blunt with it. So because it's restricted in Africa right now, for like several reasons, like the amount of grants that needs to go in this kind of experimental techniques or point of care diagnostic system is very limited, or it's probably non-existent right now. So that is actually our problem. Like we need funding to translate this. As Mete said, like it's a prototype, but we also have a box. I mean, we have two different kind of things. Like one is this particular technology, which is more advanced that we published, but there's another box which is a little bit less advanced, but it can do the same thing. I mean, it can detect the virus within like 20 minutes, and that box is already available. It can be readily deployed. Okay, but there are like few hurdles. For example, like the company right now is selling those boxes for only research purpose. We don't have the company, the iris company, they don't have the means to sell it as like a diagnostic device. So we need FDA clearance. We need to process the samples, like analyze like some number of patient samples, like before we can do those things. But these kind of things, like they require grants, right? So that is our biggest challenge. I mean, our system is ready, we can deploy it, but without funding, it's going to be like really difficult, challenging for us to like go forward. That is the unfortunate truth about it.
I would like to add a couple of things. So first of all, the advantage of our setup is we use off-the-shelf components. Like we use LEDs instead of expensive lasers, and we use machine vision cameras. So everything is cheap and affordable. And with a good planning, we have a the system can be employed in a scarce environment, and due to the alignment of the optics, the system is robust and it doesn't require like some precise alignment. Any technician can easily use that with a given user-friendly software.
Gotcha. So the advantages seem clear. A quick diagnostic, something that can travel easy, is not so expensive to make with the pieces you're using. Something someone without experience in this field can use. So I mean, it's clear the benefits. And naturally, like you're saying too, is the people who decide the grants in this nation are thinking domestically, and they're not thinking globally. And that if this is not impacting us, then why should we invest in it? Give
Right.
me the pitch then, because naturally, we're in such a global community. Traveling is so ready that this, clearly can impact America as well. So give me the pitch then that you would give to the person deciding the grant on why this should be funded. Like you said, naturally that funds isn't there right now, but what would you say to someone to try and convince them this is worth funding? You need to help us with this.
Sure. Yeah. As I said before, that our technology or the technology that we have developed is not only restricted towards monkeypox. So once, say for example, if someone buys this box, they can use this box for detecting other pathogens also. So for example, like other pathogens like syphilis, or HIV, which we need to develop the test, obviously. But easily those tests can be done using just one simple box and the cartridge. Okay, so basically what you need to do is, say for example, if you are investing in a outpatient clinic, all you need to do is to buy that box and then a few cartridges, and then obviously we'll supply the antibody that is specific for specific pathogens. So that is the easy part of it. And then what we can do is also, the other thing is, which we can bring down the price of this instrument. Like with more production, obviously the price of the machine will come down. So those are the two things that I would say. And as like you also mentioned, and we all agree that this is a global community now. Nothing is going to be restricted to a particular continent, and we have seen it with COVID. I mean, that is like just recently happened. So with monkeypox or other emerging pathogens, unfortunately, there's no funding unless like it comes and knocks at our door. That has been our tendency with like government funding. So it needs to change. And people are saying, like, for example, another case which is on the radar of like a lot of infectious disease specialists is the bird flu. I mean, if it spreads, then it's going to be like a catastrophe. I mean, people need to pay attention and then at least start supporting the research that can combat it. Like, or at least we should be prepared for those kind of scenarios, which unfortunately no one pays attention unless it is like a huge problem and it is late by the time, which was the case with COVID-19 also. There was no diagnostics initiative. And like people are traveling like crazy and it was spreading like crazy. There was no corner on this whole planet that was unaffected by the virus. Right. So we need to start spending and thinking, I mean, in terms of policies about this infectious diseases and the global impact that this kind of a spread of pathogens can have in the future.
Yeah, I think we don't have to think too far back to remember a time when there's the drive-through testing where the lines were astronomical, where everyone was saying, "I don't know if I have it, I need to check," and it was not a very quick or easy process, and finding things were a challenge. And as you say, if it's the problem's not knocking at our door, it's easy for many to forget there is a problem. So it sounds, something, if this can be implemented, maybe people aren't thinking about the threat MPOX has on America, but there's the potential for the next pandemic. And, is it safe to say this is a tool that could help diagnose something and limit the spread and limit the negative impact that the next pandemic could have?
Sure. Actually, if we look at the MPOX spread that happened around 2022, the most number of cases that were detected was in US actually. And it was spreading like crazy. Like if you look at the numbers, I mean, we are talking about the same pathogen. We're not even like comparing oranges and apples. Like we're talking about MPOX. It was a different strain although we were fortunate that that strain was less pathogenic. It was less deadlier than what like we're seeing right now. So even if you look at the monkeypox case, it was spreading like crazy, right? But it was affecting a particular patient group. I mean, for example, it was only affecting men who have sex with men. So that was the reason why uh, um, it could be combated easily, because like changes in lifestyles and things like that. So people realized it, and they helped in stopping that spread. But with this one, this clade one that we are seeing right now, it can spread either through sexual transmission or just by close contact, and it is more deadlier than the clade 2 that we have seen. So it is not
Gotcha.
the question of when, it is the question, like, I mean, it's just the question of when is going to come. Like, I mean, that's for sure. And we have seen cases in US. There was just a case yesterday that was detected in Canada. There are several other countries that have seen these cases. So it is just a matter of time when like this is going to spread around. But unfortunately, it will be like late, as like we've seen in the past, if you don't take actions right now.
With that, we conclude another episode of All Things Photonics. Thank you to our sponsors, to the technical staff behind the scenes, and to continued support from the Photonics Media editorial team. As always, questions, comments, thoughts, and ideas are welcome. Let us know how we're doing via email at allthings@photonics.com. All Things Photonics is available on all major platforms and on our website, photonics.com.